which can allow you to intake more air in through your nose. The septum, I believe, only accounts for 20% of the air intake going through the nose. Improving the size of the floor can be big for increasing how much air you can intake through your nose. Now, I've personally done treatments for both. I'm currently undergoing something to improve the floor, so to speak, and that's by pushing the teeth outward so I can have more room for my tongue on the roof of the mouth. And I've had the septoplasty. I've gotten good results with both procedures, but that's not the case for everyone. When I had my septoplasty done, within 2 or 3 weeks, my resting heart rate dropped 10 beats per minute. But I still have difficulty getting air through my nose. I shouldn't say that. I can get air through my nose, but my issue is it's still very loud and there's still some restrictions. And last time I had airway imaging, I still had some enlargement of the turbinates, even though I had a turbinate reduced. So what I think, if I would have had to do it over again, I probably would have gotten the dental stuff done first, because sometimes if you can expand the floor and you can change the shape of the floor of the nose, aka the roof of the mouth, that could potentially have some positive effects on the shape and the deviation of the septum. But that's just me. Someone could have a severe enough nose restriction that maybe that's the first place you need to go. And again, that's where, as I mentioned before, you need to go and work with someone who can appreciate all of these structures and decide what is best for you. Now, that being said, folks, if you're someone who has a deviated septum, that doesn't mean that you cannot breathe through your nose. In fact, interestingly enough, one of my dearest friends, she found out that she has an 80% blockage in her nose. Yet she is one of the better nasal breathers I've ever seen. Always breathes through her nose while sleeping, breathing through her nose, like not necessarily an issue. And the analogy that I like to give is someone could have an arthritic knee, but they might have full motion, they might not have much pain, they might be able to do a lot of activities without issues. I think the same thing is true when it comes to a deviated septum. Just because you have a structural issue, it doesn't mean that it's going to correspond with a functional deficit. Again, this is where you have to have imaging, you have to have data to let you know if this is an area that I need to intervene. If you can get air through your nose, your sleep scores are good via a sleep study, maybe it's not something that you need to work on. And there's probably some trainable things that you can focus on to improve your ability to breathe through your nose. And this is what Bryce is talking about. So if I'm someone with mouth breathing, what kind of things do I need to do to maximize my ability to get air through my nose? Well, we have to look at what things we can do to restore normal breathing mechanics through the nose. The first key, and this is what Bryce alluded to, is tongue position. You need to be able to attain a palatal tongue posture. What I mean by that is if my top hand is the roof of my mouth, you got to be able to plaster your entire tongue up against the roof of the mouth. So the tip, the middle, and the back of the tongue. That is step one. If you have any tongue restrictions, you need to improve that first. So if you open your mouth and then you do a tongue tip open, you can see when I do that it's the same distance. And if you do a cave, which hopefully I can do under pressure, like that, where you put the whole tongue up against the roof of your mouth, those distances of the amount of opening that you can create should roughly be the same. If they're not the same, you need to do things to increase tongue mobility. There's a post that I have done, Intro to Oral Myofunctional Therapy, that I'll link in the show notes, which will be found on zachcouples.com/CPAPs. And folks, I'm going to have a podcast. I'll have access to the YouTube video, which if you're watching this on YouTube right now, please, to help the fam grow, just gently tap the like button. And then also, too, folks, on the show notes, you're going to get access to the blog post that corresponds with it. Definitely Give it a shot if you haven't already. But I'll give you access to my YouTube playlist that will have a bunch of exercises to increase tongue range of motion, and I definitely want to check out the airway posts that I mentioned. So once you got your tongue loosened up, it's on point, you then need to work on placement of the tongue. When you are coaching a palatal tongue position, you need the tip of your tongue first on the rugae. The rugae is the rough spot that's just behind the front top teeth. That's where the tip should be. So you want your tip there, and then you want basically the rest of the tongue to fill up the roof of the mouth. If you're someone who struggles with tongue placement, a godsend can be these wonderful orthodontic elastics. So if you've ever had braces, and you know how they'll take those little tiny rubber bands and put them in various brackets to move teeth? Well, these bad boys are also great for coaching tongue placement and posture. So you got your little, which it's kind of tiny, but you can see right there, that's what an elastic looks like. You can place this anywhere on your tongue that is deficient in getting up to the roof of your mouth, and it's a nice external cue to getting your tongue where it needs to be. So if I had difficulty getting the tip of my tongue on the rugae, I could put the elastic on the tip of my tongue and then push the elastic up against the rugae, like so. Then when I do that, now I have this little reminder of where my tongue needs to be. And you could do this for 5-10 minutes at a time. A lot of times I'll do this when I'm in the car or when I'm working on the computer and I don't have to talk to anyone. Like for me personally, because with the myofunctional therapist who I work with for myself, I have a difficult time getting the back right part of my tongue up to the roof of my mouth. So what I'll do is I'll take one of these elastics, put it there, and then I'll plaster up against the roof of the mouth. Just like so. That's what I do to try and encourage good tongue placement. Use elastics, make sure you have range of motion. The next step is breathing through your nose with that posture. So once you got your tongue placed up against the roof of your mouth, you're going to work on breathing silently and quietly through your nose, in and out. If you feel like there's a restriction anywhere, you can do single-sided breathing to help improve the dynamics in one of those respective nasal passages. Also, too, if you feel as though you are restricted, utilizing a saline washer through your nose can be a great way to open up the airway. I'll link my favorite in the show notes, which of course is on zachcouples.com/CPAPs. So that's another way to increase your ability to breathe through your nose. The third and final thing that you want to consider is working on building up your CO2 carbon dioxide tolerance. This is where controlled pause work comes into play. What you're going to do with that is various Buteyko breathing based exercises, which if you haven't checked out Buteyko breathing, I will link in the show notes the place to do that because they got a lot of good stuff. And in fact, Patrick McEwen's book, The Oxygen Advantage, has a ton of great exercises to help you with that. But basically what you want to do is while you got that tongue posture, you're going to exhale softly through your nose, get an appropriate amount of air out, and you're just going to hold your breath and not take air in. Wait until you experience a little bit of air hunger, not like, I'm going to die, but just enough that, I could probably use some air now. Breathe in a little bit, not fully, get air out, and then just work on your ability to tolerate longer periods of time without experiencing that air hunger. And if you do those three things, you get good tongue posture, you work on breathing through your nose silently, keep your nasal airway on fleek by keeping it clean with a saline rinse, and then lastly, working on your controlled pause, you should be able to increase dynamics enough that it should be significantly easier to keep nasal breathing while you train. Now, if you are training super hard, you're doing full-out sprints or anything like that, Mouth breathing is a normal thing that should happen because your body won't be able to keep up with the respiratory demands. And sometimes that's going to be essential, especially if you're competing in an event. That's not the time to focus on getting enough air through your nose. Mouth breathing isn't always a bad thing. It is a mechanism that we have for a reason, and it's needed if there's going to be a time where you need more airflow to ensure that the cellular processes of respiration keep going. So realize that it's not always a bad thing. When poop hits the fan, mouth breathing is there for you. But if you got good tongue position, you can breathe through your nose adequately, and you work on your controlled pause, that can help mitigate a lot of the negative effects of mouth breathing. Now, if you do those three things and you still are having a hard time getting air through your nose because of the deviated septum, that might be the time where you want to get the structural stuff checked out.